Hello everyone, and welcome to another Sullivan County Town Hall. My name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and on behalf of Robert Doherty, our Chairman, and the rest of the Sullivan County Legislature, thank you for joining and welcome today. Joining us today are our Director of Public Health, Nancy McGraw, our County Manager, Josh Potosik, and our guest today is Sandy Oxford, the Director of the Hudson Valley Area Labor Federation. We're going to start today with Sandy, who has a few things she would like to share with us. So Sandy, welcome. Thank you for joining us today.
Thank you very much. Thank you for that nice introduction. I proudly serve as the Director of the Hudson Valley Area Labor Federation and appreciate the opportunity to have this exchange with my neighbors here in Sullivan County, because I believe that we are in the midst of an unprecedented future as it relates to budget cuts, austerity, and what we all must do to band together to protect the public good of services and definitely of jobs in our front yard and our backyard. I would like to begin by just sharing that the Hudson Valley Area Labor Federation, our region encompasses 7 counties: Orange, Ulster, Dutchess, Greene, Columbia, and Sullivan. And we are part of a statewide network of the New York State AFL-CIO and the National AFL-CIO. At the national level, the AFL-CIO is encouraging all of us to educate our neighbors on what we are considering the 5 essentials for moving forward and for trying to fix and to approach addressing some of the harm that the COVID-19 has had in our communities. We want to be sure that at a federal level, nationally, that we keep America healthy and that we do what we can to protect and expand health insurance for all workers. We are in a healthcare crisis. In addition to the pandemic, we were in a healthcare crisis. And right now we see that millions of people have lost their health insurance because they've lost their jobs. We see that families who have lost loved ones as a result of this pandemic are no longer insured because their loved ones are not employed by these companies and not alive to capture the benefit. So we believe that we need to expand affordable health care so all workers have access to medical testing and treatment. We believe that frontline workers need to be safe. All essential workers need safety protection on the job, including personal protective equipment, training, testing, anti-retaliation protections so they're able to speak up about unsafe work environments, paid sick leave, and hazard pay. Hazard pay is something that's very essential, and it is an element that, unfortunately, we are seeing some of the greediest corporations who had given hazard pay took it back too soon. And that is an indicator that we can approach hazard pay in a sensible way, but we need it for all workers to prevent infectious disease. We want to be sure that we keep workers' pension preserved and also employed. We're headed toward what they're considering a 20% cut, which is catastrophic across the board of many of our municipal workforces, and this is something that we cannot allow to happen in our community and to the public good and to the services that many of us rely on. We want to be sure that our local, state, and government, public schools, and the U.S. Postal Service remain working. We look back and we see what may appear to have been an austerity, but looking forward, it is a bit grimmer, and we need elected officials in Sullivan County, in New York State, and in the federal government to be creative and to band together and to capture other sources of revenue to be sure that we do not have to face these cuts in services and cuts in employment in our community. Lastly, we need to be sure that whatever we do, especially at the federal level, that it is about keeping the American worker competitive and reinvesting in this country and reinvesting in infrastructure. We have a great opportunity, and this crisis is a bit of a wake-up call to invest in some of the long overdue pillars of our economy, which is infrastructure. So the labor movement is calling on the United States of America, on New York State, and on Sullivan County to join us and to be sure that we reinvest in the vital, essential infrastructure that has made this country the power that it has been. At a state level, the Area Labor Federation wants to be sure that we let everyone in Sullivan County know that right now we're at a very critical point in the state legislature as it relates to workers' comp. And we believe that the Workers' Comp Board needs to provide health coverage and wage replacement benefits to any worker that was exposed. Workers must not be victimized a second time as they were in 9/11 when they had to fight for those for that type of recompense. We want to be sure right now at the front end, legislatively, that the New York State Workers' Compensation Board that has the authority to establish a presumption by simply acknowledging what we all know. Workers on the front lines of the pandemic are significantly at greater risk of exposure to COVID-19 as a result of their jobs. And these are the things that legislatively that we are working with our members, with our union members, many of who live in Sullivan County and work for the county, to be sure that we have the right types of protection moving forward. I appreciate Chairman Doherty and his invitation to come here today. But at this moment, I would like to pivot because in addition to my work in the labor movement, I want to just share my own personal experience here as part of the citizenry of Sullivan County that has moved through this pandemic. I gave our gracious chairman of the legislature 2 opportunities to rescind the invitation to speak today. Because I said that I was going to be very honest, and Chairman Doherty asked me to be honest, so that is what I'm going to do right now. Before I do that, though, I really want to thank Nancy McGraw, who I've dubbed General McGraw, and I started working with Nancy in this pandemic at the front end of it when a lot of calls were coming into my home and to my personal phone from workers in agriculture and in the food processing industry. I was deeply concerned with what was happening. We were 1 month into the pandemic and many people were getting sick. There was no distancing going on. Workers who were coming up positive at every single food processing plant in Sullivan County, many were going to their HR departments. And when when they showed evidence that they were positive, they were being terminated and their rights were being violated. And that is illegal. And just because somebody turns up positive in the middle of a pandemic is no reason to lose your stability in your employment. I started reaching out to all the legislators in the community, and I wanted originally to ask why the Partnership for Economic Development, the Chamber of Commerce, and the Sullivan County IDA were not on the front lines of addressing their members, their affiliates, and their clients with what was happening in the food processing and agricultural corridor in Sullivan County. And I wanted to know why there was no collaboration and no mutual aid coming from these single points of entry, which would have made things so much easier than what we had to do. Again, I appreciate Nancy for setting up the pop-up clinics across the street from the food processors in Sullivan County. I appreciate the urgency in which she did that. I appreciate the sheriff and the undersheriff who accompanied us along the way, checking in regularly to be sure that if there was any way that they could help. When we discovered that some of these food processors were actually charging frontline workers, essential workers, for PPE, which is illegal and you can't do. And I need to acknowledge and thank HRH Care, Hudson River Healthcare. I have proudly served on their board for 17 years. They are a federally qualified health center in Monticello, New York, and they also assisted in oversight with the pop-up health centers and continue to support all individuals, insured or uninsured, in Sullivan County who may be ill. The Workers' Rights Law Center that I also serve on their board and am a founder of, for their attorneys and their paralegals coming to the assistance of Sullivan County workers who were fired, who were terminated, who were discriminated because they turned up positive in the middle of a pandemic. And I have to thank the migrant educators who have always been with this community. But lastly, I cannot leave this person for last because she should actually be first. And that is leading me to another place, which is our new and young leaders. This pandemic has exposed new young people. Juanita Sarmiento from the Youth Economic Group was one of the young leaders that this pandemic helped to expose. And she has successfully collaborated and coordinated a coalition of us who have been addressing the PPE at all of the plants and the agricultural employers, and also just really helping us to deal with the information, the fact-finding, and being sure that the mutual aid that was being provided to the rest of the community was also making its way to this part of the community that it was very hidden until the numbers came up and we started seeing that their numbers increasing, where we saw Latino people being hit much harder by this. Prior to the pandemic, Sullivan County was wrestling with poor health indicators. And that, to me, was part of the structural disorganization that has festered for years here in this community. Every not-for-profit in Sullivan County notes this in their opening statements for grants, and most of us as community residents know this statistic, and we've committed it to memory. The pain from the pandemic tore through our communities, through our workplaces, and through our homes. This unprecedented economic crisis costed workers their jobs here in their backyard and in their front yard. I believe that much of this has been deeply rooted and deeply baked into a racial injustice that is in our workplace, in our schools, and in our systems. And this, coupled with the crisis of outbreaks, made it very prevalent at every food processing plant and poultry plant in Sullivan County. I know that we have a lot of work to do, and I know that our county legislature has a lot of work to do. And I just hope that part of the work that we are going to do, all of us together, and irregardless of political party, that we're all going to put our best foot forward to address the racial disparities in economic development, because this can no longer be written off. The COVID-19 pandemic exacerbated racial inequalities in Sullivan County. These inequalities have been embedded in racism, and people of color made up a disproportionate number of low-wage workers, essential workers who had to keep working in the processing plants despite their health. For as long as I've lived in Sullivan County, I've witnessed the damaging leadership of some of the economic development engines, like the Sullivan County IDA, the Sullivan County Partnership for Economic Development, and in some regard, the Sullivan County Chamber of Commerce. And I think that it's time for these economic development engines in Sullivan County to address these issues as well of their affiliates, their clients, and their members. I also want to add that I'm waiting and I look forward to the statement of condemnation of the vicious brutality that Black people in the United States are experiencing in day 13 of the unrest that we see. And it's not too late for Sullivan County to make a statement. In the absence of an official statement of support from the Sullivan County government officials, I applaud the next generation of young people who are leaders in this community, who are organizing demonstrations throughout the 994 square miles of Sullivan County to remind us that Black Lives Matter in Sullivan County too. Thank you.
Thank you, Sandy. Thank you for joining us today. And now we're going to get on with our questions. And we're going to start off like we usually do with Nancy. And the first question, what are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy, welcome.
Good afternoon. Before I answer the standard questions, I just want to thank and acknowledge Sandy Oxford for some of her comments and statements in support of the health disparities in this county, and really to talk about briefly how we have worked together with community advocates and with the the young advocacy group, Juanita Sarmiento, Hudson River Healthcare, and many of the other community members through public health, whose help without whose help we could not have quickly contained and become more aware of the growing number of cases and the disparities among the migrant workers in many of these light manufacturing plants in Sullivan County where COVID-19 was increasing. I am happy to say that the number of cases, new cases, is in the low single digits, and so we have really collaboratively worked together to address the issue, to make sure that people had education and information on how to keep their families safe, that they had PPE. And this was a true collaboration with Public Health and with Sullivan County Emergency Community Assistance Center and many, many other partners, including SALT, to deliver food and PPE and to provide education and information. Much of that in Spanish, and Public Health could not have done that alone. So I just want to say thank you. So to our question, we have 1,397 confirmed cases today. That's only an increase of about 5 since last Thursday. The majority of those are within the nursing homes. 9 people are hospitalized. That is a decrease since last Thursday when we reported of 15, so that is good. There's only 1 person in ICU and nobody is currently on a ventilator. There are 186 active cases. That's 15 less than last Thursday. 626 people still remain on mandatory quarantine. That's 43 less than last time we reported. 2,878 are off of isolation. That's 62 fewer people who have completed their 2-week or 10-day quarantine, of isolation. 32 people have passed away. Unfortunately, that's 1 more individual than last time we reported. A total of 9,230 people in Sullivan County have been tested. And I just want to go over briefly the testing clinics to date. We held 5 testing clinics in 5 different locations, 3 different locations, 3 in South Fallsburg, 1 in Liberty, and 1 in Woodridge last Friday. Of the Woodridge clinic, 57 people were tested and only 3 were positive, so that is very good. And of all of the 5 clinics that we have had, we've had about 200 people test, and 17 of those were positive. So that's about an 8.5% positivity rate. So we feel that we won't need any additional clinics at this time. However, we're continuing to monitor and watch things closely. As you know, many of the protests and people going out into the public more frequently, coupled with our reopening plan where people will be more out and about, underscores the importance of us continuing to monitor and do surveillance at Public Health, and also for people to continue to take this seriously, to wear masks, use social distancing, and hand washing so that we can keep those numbers low.
Okay, thank you, Nancy. Next question is for Nancy as well, and it reads, what's the latest figures on nursing homes, number of active cases, and deaths to date?
We have weekly calls with the nursing homes to get their updated numbers, so I don't have the most recent for all of them. But at the nursing home, at the hospital, there are currently 13 positive residents. 3 are actively being monitored, meaning they're symptomatic, and 3 deaths so far to date, as of the last reporting. The Sullivan County Adult Care Center by Sunset Lake, there are 16 currently positive and active, but none of them are symptomatic. I'm happy to report, and there have been, unfortunately, 9 deaths to date in nursing home residents there. None in Roscoe Nursing Home, and we are working on getting updated numbers from Achieve Rehab and Nursing Home.
Okay, thank you, Nancy. Next question is for you as well. And it states, or it asks, are there any hotspots in the county right now? If so, where and how is the county responding?
So as I think I mentioned before, there's no hotspots in the county right now. We're very pleased about that. That's one of the things we've been monitoring in terms of, watching closely the map that our GIS department created with the number of cases by zip code. So we're continuing to trace and all reported cases to make sure that any potential new cases we're able to quickly isolate and quarantine them and any exposures they may have had. And again, social distancing, wearing masks, and following the New York State guidance on the safe reopening will help us to keep those numbers low.
Okay. Next question is for Nancy as well. Will there be further testing clinics offered?
So I mentioned this earlier in terms of the number of clinics that we've had, so we don't see an additional need right now to have more. As you can imagine, it's pretty expensive to get all of the resources and the staffing and the planning that we need to do to stand one up. We will certainly do that should it become necessary. But we are continuing to refer people to the New York State testing sites. That information is available on our website, as well as the local providers and Hudson River Healthcare if people do not have insurance. So we understand that we can reestablish this mobile testing clinic pretty quickly if there's a need to do so.
Okay, thank you, Nancy. Our next question is for our county manager, Josh. When do you anticipate a decision by the governor on overnight camps opening? Welcome, Josh.
Thanks, Mike. Just want to thank Sandy and echo some of Nancy's words about Sandy's insights of what's happening in our some of our underserved populations. It's always a breath of fresh air to hear Sandy speak. If you listen to the governor over the weekend, he had mentioned, there's a question, he mentioned overnight camps. And I think his quote, paraphrasing, was, "I would be uncomfortable sending my daughters to an overnight camp at this point." So I think that kind of speaks some volumes to where his head is in terms of being able to open overnight camps. I think we're expecting something by early next week for a decision. Obviously, his reservations kind of speak volumes to, I think, where we may see or not see camps opening in the near future.
Okay, our next question is for Nancy. If the state does not allow overnight camps to open, how will that be enforced? Nancy?
This is a good chance to just remind everyone the differences between temporary residences where there may be a lot of children running around. It may appear like there's camp going on, but there's not. Bungalows, and then the difference between those and kids' day camps, which have been allowed to open as of June 29th. And then the one we're waiting on is the kids' overnight camps. So there's different regulations that apply to children's day camps and to children's overnight camps. And those regulations are through the New York State Department of Health. Additional guidance may be forthcoming very, very soon in terms of children's day camps, and after a decision is made on overnight camps, if the decision is made to open, then I'm sure there will be additional guidance coming out for that. So we want to make sure that that everybody knows that we've had weekly dialogues with children's day camp owners, and they've all expressed clear interest in making sure that campers and staff and the community is kept safe. They want to do the best thing for everyone as well. We anticipate they'll do what's appropriate to keep everybody safe and follow the New York State Health Department's guidance. And that'll be sort of the similar process should the children's overnight camps be allowed to open. And we will work closely, as we always do, during any type of communicable disease issue or concern with the New York State Health Department and the district office who monitors children's camps.
Thank you, Nancy. Next question is for Josh. Will Lake Superior Swimming Beach open this summer?
Yeah, it's a great question. Something we've been struggling with and working with our Parks Director, Brian Scarterfield, on that as of actually this morning. When you're looking at the phase reopening in New York State, this probably would be an operation that would open in phase 4 of the New York reopening plan. We would like to do that. Our struggle at this point is staffing. We did not onboard or hire people not knowing when we'd be able to open certain parks and facilities. So we're looking at could we safely staff Lake Superior to be able to open the beach. You can use the facilities similar to a state park. You launch a boat, you can use the beach itself or some of the picnic tables. Obviously, with social distancing, it's just that the swimming at this point is what we're looking at to see if we can be able to bring enough lifeguards on to open safely.
Okay, and our last question for today reads, what will the public need to know and do when preparing to visit reopened county government facilities? Josh?
So actually, the formalized plan will be released to the public today. The press release will go out with the actual plan detailing how operations will look. For those looking to come to the government center, a couple of highlights. We will start with appointment only for those customer service departments, treasurers, county clerk, BOE primarily. We will be required to wear masks upon entering the facility and in public spaces. We do still have the drop boxes available if you are uncomfortable in entering the building for our county clerk and DMV functions. From a staffing perspective, will still be non-essential staff limited to the 50%, no more than 50% staff in the non-essential offices through 2 weeks after we hit phase 2. So basically 2 weeks from Tuesday, we will be still at somewhat of a limited staffing perspective. And like I said, the details of all that plan will be out today.
Thank you, Josh. Okay, I'd like to thank our County Manager, Josh Potosik, for joining us again today, and Nancy McGraw, our Director of Public Health, and our special guest today. Thank you, Sandy Oxford, for joining us.
Thank you. May I just say one more thing to all of our 9 county legislators?
Absolutely.
Thank you. I would like to formally request from all 9 county legislators here in Sullivan County that I be granted permission to have a seat at the table. I would like for them to follow Article 18 of the New York State law, which stipulates that our Sullivan County Legislature has the authority to install me, Sandra Oxford, onto the Sullivan County Industrial Development Agency. I have a 26-year history as a Sullivan County community volunteer, appointed to a variety of governmental, civic, and not-for-profit boards. By any standard, I meet and exceed the qualifications to volunteer as a member on the Sullivan County IDA. Thank you very much to everyone. Thank you for the opportunity to participate in this town hall.
Thank you, Sandy. Okay, and in closing, I'd just like to say a few things. Yesterday, I had the chance to join the Community Unity Barbecue. There's a lot of good food there. And we had, I would say at any one time, maybe about 30 people there. And it was very important for people to, obviously there was quite a diverse group, diverse thought. And it was amazing in the beginning, it seemed like there were 2 separate groups kind of just there. And then our undersheriff, Chibodi, if you will, he hosted or emceed the event. And what was amazing to see as time went and people spoke, and a lot of people did speak. We had some community leaders, we had some clergy, we had some community members, and gradually people started to mingle and eat, and it was interesting to see. And as I've often stated in the past, I believe government works best closest to the people because you know people. And it's the same way with these, with the conversation currently that we're currently having about racism and equality, so on and so forth. And I think Sullivan County, it was amazing to see the people here in our community, not from the outside, but from our community, coming together, because that's where it works best. We know one another. We're not strangers. And those of us who may not have formally met before, like I hadn't met Sandy before, but we spoke on the phone, it's a great place to start. Conversation and dialogue is always the best place to start. You can't legislate common sense. I'm sure a lot of you have heard that before. You can't legislate how people think. But there's a process to change people's minds, and it's through conversation and dialogue and learning. And there was an awful lot of good that I took from that. And, you know, in light of hearing the clergy that were there talk, I believe there were 4 members from different denominations. And for those of you who may have a spiritual sense of you, if you strip away our physical bodies, what color is the soul? What preference does the soul have? I don't think it does. It's the essence of who we are. So I think that cuts to the chase as far as when it comes to these conversations we have. Just think about what we are as people. And there's an awful lot of positive going on. Yes, there are some things we need to address, and thankfully we live in a country that we can work towards that. There's a framework there to do this. And we are governed by the people, for the people, not by the government for the people, and there's a big difference. So it was heartening to be part of that yesterday. It was very positive, and I just wanted to make comments about that because it was time well spent as far as my standpoint. So, with that being said, I want to make another comment about the census. Please, if you have not already, fill out the census. And with that being said, thanks once again to our 3 guests. Everybody be safe, have a good afternoon, and bye for now.